Hey, this is Markus again, and today we're going to talk about low back and sciatica pain. There's a nice series of stretches or mechanical movement patterns that we like to put patients through to really decide, is it truly a disc or back problem? Many times you have no idea what makes your pain better, what makes your pain worse, but the benefit of seeing a physical therapist is that's what we do. We're experts at that, and today I'm just going to show you a couple of simple mechanical movements that we like to use in order to determine what happens to your pain, and then if it works out great, we like to go ahead and use those as a home exercise program for yourself. So these simple stretches that we're going to give you don't reduce the simplicity of them for their effectiveness. All right, it's really important to realize like simple is okay. We don't like to make things too complicated, but you really need to listen to your symptoms when you're evaluating if it's helping or not. So today, Carrie and I are going to go ahead and just kind of review a couple extension principles that work almost all the time. However, there are those outliers that it doesn't really work that well for. So today are for those people that it does benefit from. So this isn't the only thing in the bag of tricks, but it definitely is super helpful in trying to managing out your pain. So the first thing today, I'm going to get Carrie laying on her stomach. Now, this particular position that she's going to get to is just lying on her belly. All right, so if you have pain in your back, let's say you've been having it for 1 to 2 weeks, even just it happened yesterday, like just get on your belly for a little bit and see what happens to your pain. All right, we always talk about in physical therapy about things being more central to the back or centralization. For instance, if I have back pain is one thing, or I could have sciatica that goes all the way down into the leg. It could be just in the thigh, it could be down in the calf, it could be all the way to the big foot or big toe. All right, so we're looking at trying to change that symptom out of the big toe, out of the calf, out of the thigh, out of the buttock, into the back. So if she just lays flat and you lay flat, like decide where your pain is and understand that, all right, where it is. So the progression from just laying flat, if this feels good, just start there. If this feels terrible, all right, and you can't really even tolerate laying on your belly, maybe just slide a pillow up underneath your belly so that the back is going to be bent up a little bit to start, and then over time we can pull that out. All right, but if this feels pretty good, it feels like things are settling down in the buttock and leg, then the progression of this is going to be up on the elbow. So we've got like watching TV here on your belly, and so she's getting a nice curve in your spine. Then just like we had talked about in prior videos, we're looking at trying to bring that cut together again. We talked about if there's a cut on her knuckle and we bend forward, it's just like opening a cut and it's bleeding. All right, if I can get this cut back together, or my disc issue back together, it is going to allow it to reduce that pain in the leg. So here she should start noticing either symptoms in the back getting either less if it's only low back pain, but if she started off with symptoms in the buttock or in the thigh, then she's looking at seeing that pain slowly moving up into the back. And that's what nerve pain is very interesting, because it can rapidly change. It's so much different than just a muscle strain where it's always in the one spot. Nerve pain is always moving, so we want to see that moving up. So progression is going to be going to lay flat, so lying prone or lying on her belly first, coming up onto her elbows second, and we usually suggest just starting off at 30 seconds to a minute, progressing to 2 to 3 minutes up in this position. All right, and you're going to do that over a period of 15 to 20 minutes. We've had people even into these positions for 30 minutes just to get those symptoms to settle down. Okay, so I'm going to have her start back down flat again. Our progression from prone on elbows, all that's happy, things are going out of the leg, she's feeling better. Then we're going to go into what we call repeated extensions or a push-up position. So the arm's going to be at the shoulder level, and she's going to keep her hips and back relaxed. And then she's going to press up with her arms, allowing her back to sag to really create a nice curve in her back. All right, and then back on down. So it's a repeated movement. So we're have her just get through 6 or 7 here. There's 2. A little pause on the top. You're not holding it there long. And relax. And we really want to keep the muscles relaxed through the hips. All right, and you're always assessing your pain. Like, where is it? in here, all right? And you should always feel like the pain symptoms are becoming more centralized to the low back. And this pain here is getting more relaxed as you get through it. All right, if that's what it's doing, then this is definitely an exercise for you. All right, but a word of warning, when you're looking at trying to change your symptoms, sometimes we can go too far, too fast. All right, don't rush just lying on your belly. Don't rush just staying on your elbows and before you get into the press up. You want to really make sure that everything is settling down. Sometimes we can go too far, too fast, and instead of getting some relief, it creates more pain, and then we just abandon the whole thing. So make sure that you're going slow. This is a process that takes a little bit of time when you're working through these stretches or these mechanical movements. All right, I'm going to let Carrie sit on up here, and then what we want to do is just review one other thing in regards to sitting posture, which we talked about in our first video. We're also looking at what we call slouching and overcorrecting. So one of the ways we want to do that is to really get the vertebrae to move, okay? And we want to find where the body is happiest at. So if we, for example, Carrie can slouch, which we'd call poor posture, or we could call accentuated or increased of our lordosis, are two options. So when Carrie's, if she has back pain, then we're going to work in what's comfortable for her. So it could be coming up a little bit and then just down a little bit, slowly working through the position of comfort for her, and really start taking the lumbar and the sides and getting them to glide on each other. It doesn't have to be full down, full up, but find your happy spot and really just to kind of glide and move that back. So just a few things that we talked about today. Laying down. If you can't lay down, the next step would be to do some things in standing. So the last one we're going to show you is just a standing stretch. I'll get you up in the bottom facing that direction, back extensions. So she's just going to put her hands on her back, and then she's going to work on just bending backwards. So you can't find some place to lay down, you can get through back extensions, pressure on, pressure off. Carrie's got pretty good mobility through her low back. That might not be you, okay? You could be older, stiffer back, so don't feel like you have to get that far. You're gonna go to what feels good to you. All right, we'll get one more. And back on off. And again, same thing apply here, that we're feeling that this central low back pain is getting less, or if we have symptoms in our leg, that is reducing to the back. All right, this is one other option for you. So, let's go ahead and sit down. So if you have questions, if you want more information about this, you can just go to our website at mungerphysicaltherapy.com, or you can see our phone number here on the video. If you have any questions at all, we can help you out. If you're not around this area, then another option is to just find another expert physical therapy in your area that could help benefit your life. Be well.